Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hypercoagulable states. So under hypercoagulable states is divided into two types, that is the primary and the secondary. So we look at the primary. So under primary, there are some genetic conditions. So primary means there is under the genetic conditions. So what does it involve? It involves a mutation. So there is presence of mutations. So there is presence of mutation, and this is present in the factor 5. So presence of mutation, this is present in the factor 5. This is MC, that is the most common. Next is the antithrombin 3. So there is a antithrombin. There is antithrombin 3 deficiencies. And then comes the presence of protein C and the protein S. Protein C and the protein S deficiency. Next, as we move on, we look at the fibrinolytic defects. So there is fibrinolysis. The fibrinolysis defects. Then comes the homocystinemia. Cystinemia. There is the allelic variations. There is presence of the allelic variations, and this is in the prothrombin levels, PT levels. And there is mutations in the methyl tetrahydrofolate gene. So there is mutation, and the mutation occurs in the methyl tetrahydrofolate. So methyl tetrahydrofolate is known as the MTHF gene. Now we saw the primary. Now we look at the secondary type. So the secondary is basically known as the acquired conditions. So primary was a genetic. This is going to be the acquired conditions. So under acquired conditions, it may be due to the prolonged bed rest or immobilization. So prolongation of the bed rest as well as the immobilization. And next is, it may be due to the homocystinuria. And then comes the tissue damage. The tissue damage may be due to the surgery, it may be due to the fracture, and it may be due to the presence of the burns as well. Then comes the presence of cancer. Then is the MI, means the myocardial infarction. The prosthetic cardiac defects. The prosthetic cardiac valves are also present. Then is the DIC, that is a disseminated intravascular coagulation. Then the heparin-induced thrombocytopenia. We are writing it as HIT, that is an HIT. And as well as the antiphospholipid antibody syndrome, APAS. To learn and grow daily like this, please do subscribe.